So this is a depiction of what's right underneath the skin. But how do we get to see this stuff? We do it by making incisions. So our facelift, we make incisions around the ears. We start with an incision along the hairline here, from there to there. It goes up the inside edge of the ear cartilage there, along the earlobe here, to the back of the ear where no one will see it, and slightly down the hairline. Through those incisions, we can then lift up the skin to see what's underneath. Now, most surgeons, when they make those incisions, lift up the skin all the way to what you've seen here, all the way this cheek, down into the neck, all the way through here, into the center of the neck. And they do it on both sides until the two hands can connect. But that causes a lot of trauma, a lot of bruising, a lot of swelling, and the need for drains, the need for compression dressings afterwards. But we've eliminated that. We do something called a preservation facelift, where after making those incisions, we only have to lift the skin up to here. The rest of the surgery is all done under the muscle.